If you're struggling with fibrosis and firmness in your legs from lymphedema, this video is for you. In this video, I'm going to show you different tools that you can add to your lymphatic massage routine to help with reducing and softening that fibrosis in your legs. I'm Dr. Alex Hill. I'm a board-certified oncology physical therapist and certified lymphedema therapist. Make sure that you subscribe to my channel for more videos on how to manage your lymphedema. Fibrosis is a thickening, hardening, or scarring of the tissues. Lymphedema can lead to fibrosis because of an inflammatory process from that protein-rich lymphatic fluid and fat cells that are all pooling in that affected area in the legs. Over time, the tissues become more gel-like and then can progress to an even more dense and solid consistency. This fibrosis can make lymphedema worse and more severe over time, so it's important to address that lymphedema fibrosis early on and as soon as it's identified. Typically, lymphedema therapists will address the fibrosis with their hands, doing specialized hands-on techniques to really soften that fibrosis, but different tools can be used if deemed appropriate by the lymphedema therapist. Because working with our hands can be quite intensive, these tools can help us reduce the amount of work that we do with our hands and fingers, but can also be very effective tools incorporated into the program. The tools that I'm going to show you in this video should be part of a comprehensive program and not used alone. That means that you're using these tools with manual lymphatic drainage or lymphatic massage, as well as compression, exercises, and skincare. Keep watching until the end of this video and check the links in the description below for more videos on how to build your own comprehensive program. I do want to say that there's not a ton of research out there on which tools and programs are the best to reduce lymphedema fibrosis, but the tools I'm going to be talking about in this video are based on the foundational knowledge that we have that fibrosis can be softened with deeper pressures and that this can help with reducing fluid as that fibrosis gets better. Some things to keep in mind as we go through these tools are to first always check with your own certified lymphedema therapist first or healthcare provider before you use these tools. These are not for everybody, so it's best to work with your lymphedema therapist to first determine what's appropriate for you in your particular case and presentation of your lymphedema and your fibrosis. Next, these tools should only be used over intact skin, meaning you don't have any open areas, cuts, wounds, or scrapes. You should also not use these tools if you have an unhealed fracture, thrombophlebitis, osteomyelitis, uncontrolled high blood pressure or hypertension, and bruises. They can be used with caution if you have active cancer, are on blood thinners, have blood conditions, active skin infection, varicose veins, and altered sensation, whether your skin and tissues are too sensitive or they aren't sensitive and you have less sensation. Again, always talk with your healthcare provider first. Make sure you always clean the tools before and after you use them on your skin. You should not have any pain when you use these tools, and you do not want to use them over your bones like your knee or your ankle. Additionally, perform some warm-up exercises before you use these tools, specifically some remedial exercises. These are exercises that are specifically used to help with getting the lymphatic system flowing more and helping to reduce the fluid. I do have links for those in the description below and at the end of this video. And then finally, these tools should always be followed with manual lymphatic drainage and compression to help move out that swelling, move out the fibrosis and any inflammation from that deeper pressure that we just worked on. So let's get into these tools. The first tool is a massage roller, or you can always just use a rolling pin. These are great because you have a lot more control over how much pressure you're putting on the tissues and on that fibrosis. You can do a couple minutes over each area that you have the fibrosis in and start out with lighter pressure and then gradually increase the amount of pressure that you're providing to those tissues. The next tool that you can use is a dryer ball, or you can even use a tennis ball. I like these because they're pretty inexpensive. They're easy to hold and to move around. You're going to start out with gentle pressure, work up for a minute or two over each of the areas. And as you start to get into those tissues a little bit more, then you're going to start to increase that pressure as you start to feel that tissue softening. If this is sensitive on your skin, then you can use a towel or a pillowcase and massage over that towel or that pillowcase. That'll help with decreasing the amount of sensitivity on your tissues. The next technique is this instrument-assisted soft tissue mobilization, or IASTM. These different tools can be made of a lot of different materials, but the most common ones are made of stainless steel, and you can also get these gua sha tools online. Your lymphedema therapist may also be certified to use specific brands and treatment approaches. These tools have beveled edges, and you're going to sweep them upwards in the area that you have the fibrosis. You can use them for about a minute or two at each area. You can expect a little bit of redness wherever you're using these tools at. You shouldn't have any bruising, but again, a little bit of redness is expected because when you use these, it's creating a micro-inflammatory process. And so you're having some redness, but that's also helping to soften that fibrosis. And as that fibrosis softens, that fluid's able to move through better. These metal tools should not be used over bony areas like your knee or at the ankle or foot bones. Another technique is using cupping. So these cups create negative pressure, which helps to lift the skin and the tissues below and helps to soften it and get it more mobilized. Your lymphedema therapist will use a massage oil or cream before they put the cup on, and then giving some very light pressure, putting it on the area of fibrosis, and then doing small circles in the areas that you have that fibrosis to soften it. The cupping can also be used by getting, again, that little bit of suction and then moving it up and down the area of the fibrosis. As you can see, maybe from on my leg, there is some redness already. Again, that's expected because we're mobilizing those tissues, but we're not going for any type of pain, any type of bruising in the area. We're just trying to mobilize those tissues and get them softer. So again, any of these tools that we just went through, you don't want to use them on your own first before consulting with your lymphedema therapist because they may not be appropriate for you. I hope you found this video helpful on finding some different tools that might work for you on how to reduce your fibrosis and soften up that tissue. Thank you for watching. Make sure that you subscribe to my channel for more videos on lymphedema management.